Professor Claire Stevens, paediatric dentist, spokesperson for the British Society of Paediatric Dentistry. I said it. Hello, Claire. Welcome to the phone-in.
Morning, Nikki. How are you?
I'm fine. I want to get to the bottom of this one. And so we've also got Chris Groombridge, chairman of the Charity Teeth Team. Hello, Chris. And Michelle in Bournemouth. Hi, Michelle in Bournemouth, health visitor.
Good morning.
Let's go with you first, Michelle. So, yeah, what are you doing as a health visitor in this area?
Okay, so in Bournemouth, well, Dorset, dental health is really important. We give out toothbrushes, toothpaste at the 6-week check because we don't routinely see children again until 10 months. So, get in early. Some children do get their teeth, from a very early age. It's about getting those messages out really, really early about how to, promote good dental health in children.
Yeah, good job. But why are you needed? Sorry to interrupt
why
there.
Needed?
Yeah.
Wow, because we know that there are far, far too many children that are needing teeth out. Dental caries are a real problem. Children, are having problems. Their parents aren't registered at a dentist, so getting a child into a dentist is almost impossible. There's apps out there. I promote this to my families all the time. There's an NHS app where you can put in your postcode. You might be lucky if a dentist comes up once a month where they've got space and that they're taking on patients.
So you think it's a lack of dentistry rather than a lack of knowledge and know-how?
It's a bit of both. It's a bit of both, but I think the lack of dentistry is a huge issue. If I go into a family, I'm not being disrespectful to anybody, but, if the parents have got bad teeth, it's almost inevitable that the children will too. It's about dentistry, but it's also about education. That is a huge thing, reducing sugary snacks, reducing sugary drinks. That's the message that we really need to be pushing because, we know that we promote good habits from an early age. Going in when they're, 6, 7, whatever, it's almost a little bit too late. We need to be getting in early. Early help is really important. Health visiting, I'm not just saying it because I'm a health visitor, but, early help interventions, having a service like us, not forgetting us, increasing our funding so we can get out there, give this support. It's really important.
Yeah. Do some people not realise the correlation between Coca-Cola, for example, and tooth decay and too much chocolate and all that stuff? They don't get it.
Yeah, absolutely. Yeah, we do get it. But, that's why health promotion, because health visitors are unusual. We're not treating sick people. It's a health promotion service with specialist health promotion nurses. That's why we're so important. That's why we need to be out there. We need to be able to get these messages out to people. We have 5 mandated visits before they're 27 months old. It's not really quite enough, I would say. We need to get out there. We need to be able to get these messages. We need to have the funding in place so that we can run these groups. We can, produce resources to help educate parents.
Why do they need educating parents? I'm not being judgmental. I'm asking the questions that people are asking. Why don't they understand that Coca-Cola, other colas are available, et cetera, will rot your teeth?
Well, the thing is, we can all have things in moderation, don't we? But a bottle of cheap Coke might actually be cheaper than buying a squash or something like that. We don't want to make foods and drinks, so that people don't want them or can't have them, because we're always telling people they can do this, they can't do that. And we know that people really resist when you're telling them constantly what they can and can't have. It's about getting the message out there that things, should be taken in moderation because, diet drinks aren't particularly healthy if you have them over a long period of time and in great quantities. So we need to be getting out that message that things in moderation. You don't have to binge on things. You can have something, but maybe not have a 2-litre bottle of Coke between a family over a night. Do you understand what I mean?
Absolutely understand what you mean. You're doing a great job, and you've given us a great start with your knowledge and from what you do. It's a great call. Can I just say this has come from the Labour Party, this particular idea. That's why we're discussing it. We pick up things from all the parties, and and run with them to see if there's any merit in the policy. And I think it's a good one to dig into this. Talking of Labour, of course, they had a famous victory last night in the by-election, and we are expecting Sir Keir Starmer to be uttering a few words later this morning, and we'll bring you it live when it happens. And the implications of that by-election and other political aspects will no doubt come up in our two special party conference programmes upcoming about Labour and also the SNP. So those two still to come. We've done, as it were, the Lib Dems and the Conservative Party. What an interesting call, Claire Stevens, from Michelle in Bournemouth. It was a real picture of what's going on out there.
Yeah, and how amazing that health visitors have just, got all of this expertise. They are the trusted healthcare professionals for these young families. And I just have to applaud everything that Michelle has said and all that the health visitors are doing, because children's oral health really is everybody's business. And she's just explained so amazingly how having that important early access to preventatively focused health services can really make a difference in these children's lives.
Why is it so bad now? I'm just looking at some of the stats here. The amount of children who are suffering this way. I did read this one earlier on, and I've got a load of them, but this one, my eyes have alighted on it again. 3 in 10 children in England have enamel or tooth decay. It's going to be like that everywhere. That's shocking.
Nikki, in some parts of England, we have half of children starting school with visible dental decay. We have, and I don't use these words lightly, we have a crisis in children's oral health. Removal of decayed teeth is the most common reason for a child to be admitted to hospital in England. So when I say we need radical policy and we need investment in children's oral health, I do that based on the statistics that I'm seeing day in, day out. As a consultant in paediatric dentistry, I'm on the receiving end of children who are in the highest need. I've removed all 20 teeth from a 2-year-old child, Nikki.
What?
I'm replacing dentures 14-year-old children. I've got 14-year-olds who have never been able to access an NHS dentist. It's time to do things differently.
That's absolutely heartbreaking. From a 2-year-old child. Just run that one by me again.
Yeah, Nikki, that's not a one-off. This is a weekly event. This is, as a parent, I can't tell you the number of times I've had to step aside from the operating table because it just feels so wrong. This is a social justice issue. And, when I hear these things are too difficult, walk a day in the shoes of a paediatric dentist and you'll understand why we are passionate about working with any politician who is keen to listen and actually make a difference to children's oral health.
Chris Groombridge, chairman of the charity Teeth Team, in a second, but I want to go to a head teacher. Colin Watson joins us. Did you hear that, Colin?
Yeah, hi, good morning.
What do you make of it? You know what to make of it because you're on the front line.
Yeah, we're seeing a similar pattern in school, to be honest. And as a result, we've had to implement brushing of teeth every day down in Key Stage 1.
How do the teachers find time to do that with all the pressures that teachers are under anyway?
Fortunately, we've had it in place a few years now, and our lunchtime staff bring the children in a couple of minutes early at lunchtime, and before lessons start in the afternoon, they sit the children down. They all get their toothbrush from the brush bus, all a little bit of toothpaste on it, and all brush their teeth for 2 minutes.
When did you start this, and what made you think that you had to?
It's been going about 4 or 5 years now. We were first approached by Bolton Oral Health Team because we recognise that dental health, particularly in Bolton and in the northwest, has been particularly kind of disproportionate compared to statistics across the rest of England. So we were approached to kind of try this, and we've been doing it ever since.
Yeah. Chris,
Yes.
Good morning. I'm looking, mate, can you get to the heart of this for me? Because I'm looking at the areas in England where the 5-year-olds have the best teeth. I'm looking at the areas where 5-year-olds have the worst teeth. So just very quickly, if I may, I'm going to try and see where the correlations are between poverty and even fluoridation. Difficult one to say. I tried it. So the best teeth, Cannock Chase, North Hertfordshire, Derbyshire Dales, Brighton and Hove, Rushcliffe, St Albans, Bath and North East Somerset, East Devon, East Staffordshire, Colchester. Worst teeth for 5-year-olds, Cambridge, Pendle, Peterborough, Blackburn with Darwin, East Cambridgeshire, Bolton, Brent, Liverpool, Blackpool and Camden. Can you get anything from that picture?
Well, Nikki, the areas actually, if you actually go further into them, you've got a situation of deprivation. Since 2015, those living in the poorest parts of Britain and those areas you're describing, you've read out some certain names, but actually within them, there's pockets of real deprivation, are 3 times more likely to experience dental decay than those in the richest. And that's what it's about. There's a direct correlation between poverty and social deprivation and tooth decay. The significant regional inequalities exist. With children in the most deprived areas, 3.5 times more likely to have a tooth extracted than those living in the most affluent. I mean, if you take Yorkshire and Humber, it's 378 per 100,000 kids aged 0 to 19 versus England, where it's 205. There's a significant difference. And I completely agree with what Claire has been saying and putting across. As the research showed, in the Northwest, 26% of children in hospital for a tooth extraction are missing 3 days per year, school absences, affecting their ability to prosper.
Let's go with Danielle in Sunderland, who's got in touch, who's been listening. What do you want to say, Danielle? Good morning.
Good morning, Nikki. I just think, it's great that teachers are offering support, but in my opinion, I don't think it's up to the teachers. My little boy's 3.5. He was a COVID baby. We didn't get any health visitor support because obviously they weren't allowed in the house. And it's my duty as a mum. I chose to bring this child into the world. He needs to learn basic life skills from me and his dad, in my opinion. He brushes his teeth on a morning and a night under duress, mind. He's 3, so it's difficult, but he does it. He knows how to wash his face. He knows how to put his shoes on. It's my duty to teach him that, to set him up for life. I don't think that the schools have got enough. It's not. I don't think it's the school's job, really. I'm his mum, so that's my opinion anyway.
Yeah, which is what it's all about. Listen, get in touch if your child has had an extraction or is due to get one. Tell us about your own child's health, and it might very well be the case that you can't get a dentist. That's also a big aspect of this. Why do you think, Danielle, that some children do not know that this is the right thing to do, and some parents do not know that this is the right thing for their children? Why?
Well, it's that whole thing, isn't it? It's that, I know it's a cliche, but it's nature versus nurture, isn't it? If your parents don't know how to do it and they've got, they don't really care about giving your child the best setup in life, they're not going to be bothered whether the kids go to school with dirty hair or dirty teeth. And if the kids are, and again, all comes back to the cost of living as well, because like the health visitor said who you had on previously, are they going to spend £3 on a tube of toothpaste, or are they going to spend 50 pence on a bottle of a full fat Coke? So it's like, it's all coming down to the cost of living as well. It's just a vicious circle. They can't be bothered, they can't afford it, they won't do it, so, and it's the children that are suffering.
Claire, address this from Danielle. Can't be bothered?
It's not the experience that I'm seeing. I am seeing families who are desperate for support. I'm seeing families who have witnessed their children having multiple dental infections, potentially going to A&E, and seeing the consequences of oral health when it's too late. And I've seen parents putting temporary fillings in their own children because they can't get access to NHS dental care. So I'm not saying that supervised toothbrushing is the only answer here. I'm saying it's part of the solution. And I'm not saying that parents don't have a responsibility. Of course they do. But as a society, we also have a responsibility to support the most vulnerable children who, through no fault of their own, are born into a lifetime of poverty. And we need to break those cycles. You know, it should be that every child gets the same start that my children have been privileged to have. And that's why I advocate for this so fiercely. It's not just about the prevention. That's absolutely important. And if we can even forget the children in this, I can't, but if we can, then actually from an economic perspective, it makes sense too. Because for every pound that we invest in supervised toothbrushing, it actually delivers several fold in a few years' time. And we know that from the research north of the border. And then combining that with the toothbrushing packs for these early years settings. And remember, this is targeted. So this is going to those most in need. It's not a blanket offer. It's about lifting those children from the poorest prospects and giving them a chance at the best start in life.
Do you want to come back, Danielle? We've got Kathy as well. Interesting points there from Professor Stevens. Danielle.
No, she's right, and I totally agree. You know, I mean, me and my little boy's dad, we're not, you know, rolling in bags of money. You know, we're just in the northeast. We've got normal jobs, but it's all about priorities. It's what you spend your money on and how you set up your child to have the best start. You know, if I could, you know, Eddie's gone to the best nurseries. He's gone to one of the best schools in the area. He hasn't chose that. I've chose that. So for something as little as showing him how to brush his teeth, then, you know, I firmly believe that that's up to me and his dad. But Claire's absolutely right. Why should children who don't have the support network that my little boy has miss out on that? So, yeah, I mean, she is right. If that needs to be done by the teachers, then yeah, but I'm 100% behind that. Because then again, it's the children that suffer, isn't it?
It sure is. Good morning, Kathy.
Good morning, Nikki.
A school nurse, what are you seeing when kids say,
So we used to do a lot of toothbrushing public health work. So we'd go into school and, you know, show the kids how to brush their teeth and how to look after their gums. And then maybe on a bigger assessment, talk about diet and health with families. But since we've been cut school nursing, I know it's political, we can't have that intervention as much as we would like because our services are so stretched. You know, back in the day, you used to have school nurse in every school, but now you have a wide range of different schools that you have. So your service is so stretched that sometimes the dental care doesn't get the priority needs. And now look at us, we're talking about toothbrushes in schools, which is a really good idea. It really is. We know we need to be proactive and we need to sort of help the children get onto a healthy start. However, as a profession, we're really stretched. And it's sorry to say that the dental hygiene gets lost in all of the other health promotion. So I think it's brilliant that we're talking about this, having a conversation, looking at trying to improve kiddies' dental health.
Excuse me. How bad are the teeth that you see? How bad is, because it's been described, I think it was described there by the professor as a crisis in kids' teeth. That's what Claire Stevens said. What's your experience, Kathy?
Absolutely. My other hat, it's Paediatric hat, and I used to work in day surgery, and it is not uncommon to have children all their teeth removed. It's not. I mean, it makes my heart sink because, you know, that is going to be a painful experience for the child and the parents. And so you're seeing through it on both sides of my health promotion, trying to prevent the very thing that I can see. And you think, well, we need to do something in the beginning and sort of trying to help stop that. As I say, it's as when the lady from the Dental Association, the professor, she said about children having all their teeth removed. I was literally on the telly and I turned to my husband and went, well, it's common, shrugged my shoulders, which is a real sadness because it sometimes is an indicative part of someone else's health, isn't it? Dental health can sometimes be a gateway to other people's health, and if we're not, as a school nursing service, focusing on that.
Are you talking about first teeth being taken out or second teeth?
Yes. No, it's your first teeth.
Yeah.
First teeth. It's not unsurprising. And obviously older children having other extractions as well.
Yeah. We've got Julie in Leeds, foster carer. Good morning, Julie. What would you like to say?
Oh, hi, good morning. I'd just like to say that there was a lady on not long ago, and I totally agree with her opinion that it is a mum's responsibility to learn children to brush their teeth. It's your duty of care. But when children have come into care through neglect and haven't had that care going forward, as a foster carer over 20 years I've been fostering, that's very important to me to put that into practice. They need to learn to brush their teeth. They need to have that routine. But with social services now, you're not allowed to do that. You can't challenge these children to do the teeth. You've got to just, if they're unhappy about brushing their teeth, you've got to accept that. And I think that's totally disgraceful.
Really?
That is, yes, really.
But you're a mum effectively for a while. And I think what you guys do, do is amazing. I've know a bit about that world. And you're extraordinary people, but you play the role of parents, and parents' duty, or what they should be doing, if they have the knowledge and the wherewithal, is making sure that their kids' teeth are in good order. But you're not allowed to.
We're not allowed to challenge them in any way. If they refuse to brush the teeth, that's it. You've got to accept that.
That's so interesting. And are you challenged? Because kids challenge all the time.
Yeah, of course they do. But you don't force them to brush the teeth. You coax them and talk to them, and say, you try to make a game of it or a bit of a fun routine. But with the older children, I'm talking about maybe 11-year-old, 10-year-old. That they'll be angry, that they don't want to do, and they'll slam things about. But you just encourage them, and we're not allowed to do that now.
But what can you do? What can you do if they get angry and start throwing?
You cannot do that. You cannot challenge them anymore. If they say no, they're not brushing the teeth, you've got to accept that.
You can explain why it's necessary, can't you?
We do, yeah. Oh, yes, we talk to children and explain that, you can eventually your teeth, you're going to have a lot of problems with them if you don't look after your teeth and your health's sake. You've got to brush teeth to keep them clean. And gum disease and everything, but that's it. The children don't want to listen to things like that because they don't understand at that age, do they? They're not. It's when they get to teenagers and they realise and they think, I wish I had listened and done my teeth. But we're told if they are challenging that they don't want to brush the teeth, accept it to no and just leave it.
So how bad are the teeth of some of the children who come to you, and how old are they?
Oh, I've seen some shocking teeth. Yeah, some young girls. I've gone through dentists with them in the dental hospital, and I've been on the trolley, and they've been terrified, and they've had to have like 14 teeth out, and they can't go through with it. They're terrified, and they've run away. It's shocking. It's tooth decay.
14 teeth out?
Yeah.
How old?
Probably 9 years old, this certain person, yes, 9 years, and had 14 teeth out. But she didn't go through with it then. She actually ran away out of the hospital. So, it is shocking that you can't challenge children to do the teeth.
Kathy, come back in here, school nurse. This is, it's heartbreaking. I think that was the word used by Claire earlier on.
Yeah. Again, it's all the things that we've heard before. It's really shocking, and having anxiety over having toothbrushing, and seeing a lot of children coming into the care system with really poor dental hygiene, with neglect, and it's a symptom of that. And it's really worrying. As I say, we're seeing it every day. If it's not school nursing, if people are coming in and worried, or if it's at day surgery, it makes your heart sink, doesn't it? Just listening to the foster carer. I've been sitting here nodding and going, yes, we know, we've seen it all. And I say, and it's good that we're talking about it. When was the last time we talked about dental care in schools? I think it's brilliant, but we need it to be put into place.
Chris Groombridge, your heart must be sinking as well, chairman of the charity Teeth Team, and I'll come back to Claire in a second. Are you allowed to challenge? Do you challenge kids who say no?
I mean, the answer to that is really the Teeth Team's one of the successes is it's peer pressure. What we find is when we go into schools, sometimes we start with just 1 year, sometimes start the full school. It depends, what's the best way to implement it within that school. But what we find is we have a very high uptake, positive parental uptake from the parents. We always have an element that don't want to participate. And what we find is that once the children take part, basically they go, the majority of the kids are doing it. We're not doing it. We feel we're missing out. And then very rapidly what happens is the majority of those, the minority, that are left, generally then participate. They feel, they want to take part because their friends are doing it. And generally what you'll find is actually children themselves will pressure their parents to sign the consent forms to make sure they do participate.
And Claire, how important is it, and how much difference does it make if the damage has already been done?
Well, this is why the focus is on early years. So the focus is on 3, 4, 5-year-olds with the idea that we're getting in early and preventing the disease before it happens. So, brushing can be started at any age. This is something we would support at any age, but the fact that it's targeted at 3, 4, 5-year-olds is definitely the way to go, because the hope then is that you get the children before the decay has started, and you then give them the skills and the motivation to maintain a caries-free mouth.
Yeah.
I think, Nikki, what you're doing today is just great. I mean, we need to have this conversation. It's not a problem that just dentists can solve in isolation. It's amazing that we have a major political party willing to start that conversation, and let's keep it going, because what you've brought together today is not just dentists, but you've brought together parents, you've brought together teachers, school nurses, health visitors, and we're all recognizing that this is something that is not right. This is something that needs to be done differently, and I'm really excited to see where this conversation goes next.
Well, you're so right. We've had some brilliant contributors as well. The conversation will go next with some texts which have been coming in, and as ever are enlightening. And I'll come to those very, very soon. 08085 909 693 85058. We are talking about children's teeth. It's time for the news.